What is the political will telling us? What is the feasibility? What is our capacity as an organization to make sure that implementation can also happen?
Welcome to a winning mental health movement, a space where we turn conversations into action for mental health. I'm Karis Myrick, the Senior Vice President of Partnerships and Innovation at Inseparable, and I'm thrilled to be here to guide you through this series with my fellow co-hosts. Inseparable is a national organization driving transformative policy change to build a mental health system one win at a time that works for everyone, because no one should have to struggle alone.
I'm Kathleen Doughty, and I serve as the SVP of Campaigns and Communications at Inseparable. Inseparable's work is all about hope, action, and impact, and that's exactly what this podcast embodies. In this series, we'll learn from experts on the front lines of mental health advocacy, break down life-saving policy wins, plan for the work ahead, and hopefully inspire you to join the movement.
Because we can't do this without you. I'm Eliason, Director of Policymaker and Candidate Relations here at Inseparable, and as part of our WIN workshop, we've been training with advocates across the country to build a grassroots movement for mental health care. This podcast series was adapted from the live virtual sessions we conducted with our inaugural cohort to help distribute critical information to the people fighting for better mental health policy. Whether you're a policymaker, a caregiver, or someone who's struggled to get help, this is your invitation to join us as we learn how to not just fight, but win mental health campaigns, because winning saves lives.
Thanks, Allie. And thank you all for being here for the third session. Today, our focus is policy development for a winning mental health movement. And we have just an extraordinary panel. We have Angela Kimball, who is Inseparable's Chief Advocacy Officer. We have Representative Steve Eliason from Utah and Brittany Hayes from Oklahoma, who are some of the most savvy and smart policy minds. So I will, without further ado, kick it to Angela to start the discussion.
Thank you so much for that, Kathleen. So I'm going to introduce Representative Eliason first. I'm so delighted to be here in the studio with you, Representative, who has served in the Utah House since 2011. Representative Eliason is both a CPA and a senior director at the University of Utah Hospital. So he brings this really strong background in finance and public health to his legislative work. And he has passed over 100 bills, including dozens focused on mental health and suicide prevention. His leadership is so phenomenal. He's known throughout the country, and he's earned numerous accolades, including the Mental Health Champion Legislative Award from Mental Health America and the Public Health Hero Award from the Utah Public Health Association. So welcome, Representative. And also joining us is one of my favorite people, Brittany Hayes, who is the Policy Director at Healthy Minds Policy Initiative. So Brittany is a licensed attorney and teacher in the state of Oklahoma, and she's become a public policy expert who is so focused on improving mental health systems through data and evidence-based research. Her work spans education, civil and criminal justice, and she's a passionate advocate for using policy to drive meaningful change. Before her current role, Brittany served as Mental Health Policy Fellow at Oklahoma Policy, clerked at the Oklahoma Court of Criminal Appeals, and has been engaged in community advocacy through various legal clinics. So welcome, Brittany. Thank you both for being here. And the first question, I'd like just very briefly for both of you to share a bit about yourself and how you made your way into a career in policymaking. And I'm going to turn first to Representative.
Yeah, thank you. So when I ran for office, I didn't run on a mental health platform. And shortly after being elected, 3 children in my son's middle school died by suicide. And a young man in my scout troop who attended that school talked to me and said, there's kids dying and nobody's talking about it. That led me to go talk to the principal and say, what are you going to do? And she had a really innovative idea that actually led to my first mental health bill because it was so successful on the school level, and it's still in place today. And as I started getting into it and learned that suicide was the leading cause of death for children in Utah, I really had no idea. And then not long after that, my own son was hospitalized. So it became a very personal passion for me. And then I also realized this is an extremely bipartisan issue that we can make a difference. And so that's really kind of what got me started.
Oh, that's wonderful, Representative. And thank you so much for giving your career to this important topic.
Thank you.
And Brittany, would you mind sharing a bit, because you took a very interesting route to this work?
Sure. So I actually started in the classroom, and it was when I was in the classroom that I realized that there were things outside of what I could control in my class impacting students, things like IEPs and 504 plans. And so I thought, I'll go to law school and I'll represent student rights and do FERPA. And then I got to law school and was working in my local public defender's office. And one of the very first people that I ever went to interview was a former student. And that's when it hit me that it wasn't just like these small micro things impacting the student's life. There were systems and challenges and policies that needed to be changed. So just like I couldn't change one kid's outcome in a teacher relationship, and I certainly wasn't going to be able to fix the system client by client, I took the policy route and figured that mental health is sort of the asterisk on every level of policy. And I really wouldn't get bored because I could talk about education, I could talk about finance, I could talk about the law, all through this lens of mental health.
That is wonderful, Brittany, and so inspiring, I think, to all of our class participants who are on here today. So now I want to segue a little bit and talk about the fact that you've both advanced significant mental health legislation. But when you think about mental health policy, the possibilities for somebody who's diving into it can be really overwhelming. It's a very broad and deep field. And I wondered if you could share a bit about how you decide what mental health legislation you'd like to pursue. And Representative, let's start with you. How and where do you get inspired? For example, you advanced the Safe UT legislation, school mental health screenings. Would you share how those came about?
Yeah, sure. So when we first started working on this, we were focused on youth suicide prevention. And I developed this analogy that mental health is like a train. And crisis intervention, suicide prevention is the caboose, because we don't want people falling off that caboose. We want them back on the train. And, every car is a different area. You got mental health correction, correctional mental health, you have insurance, you have, SMI. I mean, there's all these different avenues, state hospitals that all have areas that you can work on. And I kind of viewed the engine as, the socio, biopsychosocial drivers of mental health, adverse childhood experiences, which that's a much more difficult area to address. But so we really started on crisis intervention because we're like, we need to save lives. It'll be a long time before we can get upstream. I think it was Desmond Tutu who said, eventually you need to go upstream to find out why the bodies are falling in the river, which I think is appropriate. So the ideas come from constituents, they come from other states. They say states are the laboratories of democracy. Beg, borrow, steal other ideas. I don't care as long as they're good ideas. We're willing to share our ideas also. Safe UT had its genesis with the Columbine shooting, where our Attorney General wanted an early warning system, a tip system, see something, say something. And we just, as an experiment, said, let's add crisis intervention and allow those students to not only submit a tip, but talk to a licensed clinical social worker 24/7, 365. We were so naive, we only added 2 FTEs for this. And now we have a whole team, and there's probably not a minute that goes by that there's not a student chatting with one of our Safe UT therapists. We have over 1 million threads a year, conversations back and forth between students and therapists. So every idea has its own unique genesis. And this last legislative session, I finally jumped into prisons and jails and mental health care. I knew that was going to be, I thought I could probably work on this for 10 years. I got to start somewhere. So we got some good legislation passed in that arena.
Well, that's wonderful. It's so inspiring that the ideas can come from constituents. They can come from other states. They can come from anywhere. That's so important.
Yeah.
Brittany, let's turn to you. I know the Healthy Minds Policy Initiative has a team that's very strategic in its planning. Can you share a bit about how you develop your policy agenda?
Sure. So we really rely not only on the strategic plan that we develop, that we ask for community feedback from. And for us, community is everybody from policymakers to folks with lived experience, saying, does this match the needs that you've identified in Oklahoma? And would it solve the problems that you've identified in Oklahoma? The first calculation generally is feasibility and political will. There are some things that just aren't going to happen in Oklahoma, and we can piecemeal get there. But that takes strategy. You need to know the direction that you're going. You need to know how those pieces eventually fit together in order to accomplish the ultimate goal. And for us, Oklahoma is sort of interesting in that we've got a very populist tilt. So a lot of times Oklahomans are looking to solve problems where they feel like they are the victim or something's going wrong in their community. And so a lot of what we do is communicate with some of those folks and compare it to what we've got in our strategic plan and say, what is the political will telling us? What is the feasibility? What is our capacity as an organization to make sure that implementation can also happen? It's great to go in and yell and cheer when you pass a bill, but it's completely different to follow that up to make sure that it's implemented and measured to see if it met that goal. So unfortunately, it kind of goes back to the policy wheel that I think we probably all learned about in undergrad, but it's really problem development, problem identification, and that feasibility calculation.
That is so helpful, Brittany. And if I can follow up, I'd like to talk a little bit more about how long it can take to turn an idea into legislation and into enacted policy. And I know this can depend on the topic. Can you share an example of a couple of different pieces of legislation that have different timelines for the work that you do?
Sure. So, two examples come to mind. Oklahoma is a very rural state, and so workforce and access are always going to be huge issues. And so, one of the quickest turnaround bills that we had, at least on the legislative side, was a bill that mandated all insurers pay for collaborative care. And collaborative care refers to a behavioral health integration model that has four specific codes, or three specific codes, but we added additional code on. And passing the bill, easy. Drafting the bill probably took less than an hour, but it's the implementation. It's at the end of it where now we have meetings every 6 weeks with providers to see how implementation's going. We're at the point where we're measuring what the impact of turning on those codes has been. And the timeline, even though that was really quick, our estimate is always sort of, can we get this done without legislation? Legislation really should be the last priority, or not the last priority, but the last stop. Can you get it done through a rulemaking? Can you get it done through collaboration? Can you get it done in any other way than putting it on the books? And so collaborative care, very, very quick and easy on the legislative side, but implementation is taking a long time. On the other side, we're really focused on generally accepted standards of care. That's the thing that we've been looking at since 2022, but it hasn't been politically feasible. And we think that next year, so it's sort of building these different pieces to get to generally accepted standards of care. It doesn't mean that we don't think about it. It doesn't mean that it's not in our plan. It just means that we know we probably only get one bite at that apple, and we need to make it the most accurate, precise bite that we can. So since 2021, 2022, we've been doing the coalition building. We've passed a couple of bills that are flirting with generally accepted standards of care. And next year is the year that we are going to deploy that because we feel like we've got the good opportunity now.
Oh my gosh, there was so much in your two answers there, Brittany. So if I can summarize and correct me if I missed some of this, but with the collaborative care model, relatively simple legislation, quick to pass, draft, but the part that took more time and is so important to do is that making sure that it's implemented in a way that is serving the needs of communities. And you've been doing that. So that's an important piece of this policy development is understanding that. And you added something else too. You mentioned that legislation isn't the only route forward. And a lot of times this kind of policy advancement can happen through rules, through regulations, or even through voluntary agreements with key stakeholders. But then on the flip side, working on something like insurance reform, much harder. And what I heard you say is you've been working on coalition building now for years. planting the seeds. And I love that flirting with the idea of legislation with sort of softer ball, attempts at legislation that, takes baby steps in that direction. Those are really helpful things for everybody to be aware of as they're working on these issues. So now, Representative, a twist on this whole question, I'd like for you to talk to us about perseverance. So when one is trying to pass legislation, you may hit road bumps for various reasons along the way. How do you deal with those bumps in the road?
Yeah. So before I get to that, I'll have to talk to Brittany another time because this is my first time meeting her. I don't know how I've gone so long without meeting her. But I'll just give one quick example on the last one. Years ago, I just called up our Medicaid office and said, hey, we don't have the collaborative care codes turned on for Medicaid. Do I need to run a bill to do that, or can you just do that? They got to me back a few days later. Oh, we turned them on. So I didn't have to have a bill. Now, we didn't have to run a mandate. We got the commercials through a little nudging to do it. So yeah, there's different ways to do that. But in terms of perseverance, you just have to know that we didn't get here overnight, and we're not going to solve the problem overnight. And I've had a number of bills that take 3 sessions to get passed, and particularly if they're funding bills. So I last session tried to get funding for additional 40 state hospital beds, and I've gotten funding years ago for incremental beds, and this past session I wasn't successful. But if you just keep coming back, I think psychologists call it the broken record technique, where I'm just coming back until you can get what you're looking for. I'll give one quick example. So we tried in, I think it was 2015 and 16, to get a 3-digit number in Utah for suicide prevention, to access the suicide prevention lifeline, and we failed. Telecom flew their lobbyists in to try to kill the bill, and they were successful. But one of them said, this is such a good idea. It should be national. It just doesn't work regionally. And so we're like, okay, well, we failed at the state level. Let's go to Congress.
Love that.
And so I passed a resolution in 2017 calling our members of Congress to do this. And Senator Hatch and Congressman Stewart then ran the Lifeline Improvement Act, and hence 988.
Thanks to the great work of Utah.
Because we failed.
Thank you. I love that. That's a great lesson from failure. It can lead to bigger and better things. So that's wonderful. So we've talked a little bit here about funding, and the reality is one of the biggest challenges for policy advocates is the fact that many policies have a fiscal impact. They cost money, and that can be a tough go in an environment where states are dealing with reduced revenue. And we're expecting much more of that as a result of congressional actions that will impact state budgets. So what's your approach? How do you deal with policies that have a fiscal impact versus policies that don't? And Representative, I think you have some words of advice, or at least I've heard you in the past talk about some sort of innovative approaches or low-cost approaches when budgets are tight. Would love to have you share an example.
Yeah, certainly. So I have like a 50-page PowerPoint of, maybe 60, 70 behavioral health bills we passed in Utah. And on all the slides, I break out the fiscal note.
I want that PowerPoint.
Yes, I've seen that. And the vote count, so they can see how bipartisan it generally is. But if I can run a bill without a fiscal note, that's always going to be ideal. Because like this last session, I had a big behavioral health bill that was the result of our behavioral health commission's year-long work, and it had big fiscal note. And I had to whittle it way down to make it fit the funding. The bill passed unanimous through the whole process, but we don't allow a final vote until it's funded. And I couldn't get all the funding. So I had to compromise, don't let perfect be the enemy of good. So I had to scale that down. It's surprising though, how many bills, even you like the school mental health screening bill, I did have a fiscal note on it, but I actually didn't need it. It was just for kids who screened positive and didn't have insurance or had a large deductible. If you can leverage community resources, like our parent night that we hold in basically every school district in Utah, we have community providers that are willing to come in and do these workshops for parents. The school buildings are free, didn't have a fiscal note. And so you have to every state will just have to say, what are we trying to do? And one thing that's worked really well for me is to leverage public-private partnerships. So we created something called the Live On campaign in Utah. And I ran the bill and it said, okay, there'll be $1 million of one-time state funds if it's matched by the private sector. In 3 months, we'd raised $1 million and had this fabulous campaign on suicide prevention and mental health awareness. And then I was able to come back in a future session and say, look how successful this has been. Let's get ongoing funding. So the bottom line is you do what you can within the resources that you have.
I love that. That's so innovative, and I think so valuable for everybody on this to hear about, and that is public-private partnerships, not letting the perfect be the enemy of the good, taking incremental steps, leveraging what resources are out there. That's so wonderful. Brittany, would love to hear from you on this as well. And as a follow-up, are there any policies that don't have a fiscal impact that advocates ought to be thinking about?
Sure. I mean, I was also going to mention public-private partnerships. For those of you that don't know, Tulsa is actually like the most philanthropic city in the country. A lot of that comes from old oil money. So public-private partnerships are something that we use very, very often. But we also ask the question of, yes, a fiscal note is a fiscal impact to the state, but what is the cost to taxpayers, to those who are covered by health insurance, of not doing the plan action? So we do a lot of cost analysis, and I went to law school to avoid numbers, but we do a lot of cost benefit analysis of saying the cost of implementing the policy is X, but the cost of not doing the policy is Y, and breaking that down over time. As far as policies that don't have a direct fiscal note, a lot of what we do is really putting on the books collaboration. So one of the bills that we passed 2 years ago required every school district to come up with a crisis plan for students. And so that meant that each school district intentionally had a conversation with their community mental health provider that said, here is our memorandum of understanding about what is going to happen if a student is in crisis on campus. So that means that we had school districts reaching out to community mental health partners for the very first time. Is there kind of a financial impact to the state? Yeah, kids are getting services, and sometimes those kids are on Medicaid, so there's a cost to that. But the cost of creating those connections between the schools and between community mental health and being really intentional about bringing parents into that collaborative process was one way that we achieved big policy success without there being any fiscal note.
I really love that, Brittany, because this idea of promoting collaboration and coordination, even mere introductions between different parts of our systems that are serving children and adults with mental health challenges, is so powerful and something that can be done on a shoestring. So that is wonderful. I'd like to circle back to the discussion on strategy and would love for both of you to talk a bit about the feasibility of getting legislation over the finish line. And what are some of the key considerations that come up for you before session in terms of feasibility and how you think about it?
Yeah, so in Utah, we have about one of the shortest legislative sessions in the nation, but we'll have an interim day most months that we're not in session, where we have committee hearings and can introduce legislation. So I try to, at least for controversial bills, which most of my mental health bills haven't been controversial, but some of them, dealing with civil commitments and mental health screenings have had some controversy. I try to get those unveiled as soon as possible so I can get the stakeholders talking about it. And then I go to the groups that I know are going to be stakeholders and try to either get their support or get them to go neutral. I had one parent group that I said, I want your support for this bill. And they're like, are you kidding me? We can't support the bill. I'm like, and I explained it to them. I'm like, can you at least go neutral? And they're like, oh, okay, we can go neutral. I'm like, that's all I'm asking for. And then in another bill, I had a group of pediatricians like, hey, tell us how we can support your bill. And I said, I got just the right answer for you. Don't say anything because you've alienated this other group of Second Amendment people that are on board with this bill and you might scare them off. And they're like, okay, we won't say anything. So you kind of just have to know your audience and know which ones you want to support. And then one of the key things for me on a controversial bill is going into that committee, knowing what my vote count is approximately going to be, talking to the members of the committee individually, seeing if they have concerns, and not just, kind of putting the vote on the roulette wheel and saying, well, I don't know how this turns out. Doing your homework, which behind the scenes is difficult. I had a bill healthcare related bill last session, and I got, I think, 43 co-sponsors. I only need 38 to pass it. So when that bill's unveiled, they're like, the opposition's like, he already has more co-sponsors than he needs votes to pass it. That's a rare strategy, but it's one that I'll employ if I need to.
I love that. But what it points to is that you do a lot of homework before anything even comes up for a vote.
Absolutely.
And you're not scared to reach out to those who might be opposing. In fact, it sounds like you invite those conversations.
Yeah, there's an old saying that says, stay close to your friends and even closer to your enemies. That holds true here, because the last thing you want is when you have that first committee hearing for these groups to show up that are going to be opposed to it and throwing out arguments that you haven't had time to think about how to respond to, or maybe suggestions that you're like, oh gosh, a minor tweak, though it's not a big deal to me, but it's a big deal to these other stakeholders. Oh, I can do that and compromise. I want to get that dialogue going way before that bill goes to committee or to the floor.
Such great advice. Brittany, would like to turn to you. Do you have any thoughts on this?
Sure. So for us, author selection is a huge deal. So I obviously am not a lawmaker. So the additional layer for me is building and making connections with lawmakers and being able to identify who's going to carry a bill, who's going to carry that bill well, who will put in just as much work as I'm putting in to make it good policy. In Oklahoma, that often means building coalitions with Republicans more often than Democrats, just because of the makeup of our House and Senate. So that's the additional layer of relationship building. But we have something similar called interim studies. So interim studies happen in the fall. Angela and I have co-presented on an interim study in Oklahoma, and those are really an opportunity for lawmakers to learn more about a topic, usually before legislation is introduced in the next spring. But I also am a former teacher, and I go back to those roots all the time. So there is never a publication that we have, any communication that we have, that we're not introducing a new term that we plan on being important in the next couple of sessions or in the next couple of months. So we'll have an interim study that is intended to talk about one topic, like harm reduction or like insurance reform, but we'll sprinkle in definitions and little previews of the strategy moving forward so that we can create a common language around policies. I feel like in mental health, so often we have so many different definitions and we're talking about the same thing. My favorite example is in education and mental health, where if you've heard of MTSS, or multi-tiered systems of support, it's like a very simple triangle, right? Where the bottom portion of people, like 80%, just need to be in a supportive classroom in a good school. The next layer, about 15%, might need some additional intervention, maybe a group therapy, a reach out to a parent, and the rest of those top 5% need a more intensive intervention. That triangle exists in education and other places. There's a math triangle, there's a reading triangle. So as much as we can create a common language to really make sure that there's understanding across the board, that's how we build consensus and develop usability and build political will, is by comparing it to things that are already generally accepted and understood.
I love that, Brittany, and there are so many key pieces there for people to remember. I love that discussion of language, and I think so often in the advocacy world, we use things like comprehensive school mental health, continuums of care, and people's eyes glaze over. And if you think about something like a triangle that people are used to, and you're talking about, hey, 80% of kids just need a safe and supportive classroom in a good school. That is something that's very relatable. And that takes that sort of policy language and makes it something people can understand and relate to. Also, you talked about really developing relationships and getting the right bill sponsors. And I want to revisit that a little bit, because I think a lot of times it's easy for policy advocates to want to go to a natural champion, somebody who cares about the topic, but they may be, for example, in Oklahoma, a new Democratic Party representative who is not on the right committees, doesn't have power, isn't in the majority. Can you talk a little bit more about how important it is to have the right sponsor, not just the most sympathetic sponsor?
I mean, for us, sometimes it's a way to prove, like, sometimes we choose a naysayer that we have taken time to convince so that when they present the bill, it's like, If they're bought in, then there's no way I'm not buying in. So it's really about identifying the person who has already built trust. If they have, we had a particular bill author this year, just a financial and health guru, but a little bit suspicious of alternative payment models. And so spending the time to sit with him and explain it and get him bought in, when we presented it and he presented it in committee, more than half the committee said, well, if you're on board, then I know we're good, so I'm on board. So it's knowing who other people trust and building that relationship with them, so that there's recognition and acknowledgement. But on the back end, as advocates, it's also making it easy for the author to carry the bill. We write all the language for them. We write an FAQ for them. We draft questions we anticipate that they'll hear in committee and have the answer written out for them as well. We create one-pagers. It's happened more than once that an author will come back to us and say, hey, what are you working on? I might like to carry that. So it's creating that dependable and reliable relationship where you're getting everything that they need from you. And pretty soon they'll ask you if there's anything that they can do for you too.
Oh, that is wonderful advice. Representative, can you share how that might work in other legislatures? Is there a common need for people to have, or lawmakers, to have one-pagers, the talking points, the anticipated questions?
Yeah. I kind of use this continuum of good, better, best, where it's good if somebody brings me a problem. It's better if they bring me the problem and some recommended solutions. It's best if they're like, hey, here's some model legislation that we've kind of drafted up. And here's a one-pager. I always tell my intern during the session that our one-page flyer needs to be very succinct and lots of pictures. And one of my colleagues sent out a flyer. All it had was a picture on it. And I'm like, this is brilliant. I got to study and see what they're trying to communicate here. So yeah, keeping it simple is really critical, but selection of sponsors is critical. If you know that it's going to go to, my case, the House Human Services Committee, then maybe I should first think about selecting that chair as the sponsor in the opposing body, because people don't usually vote against the chair's bill. Or maybe look for one of them. If I have a firearm related bill, look for maybe the most conservative member of the Senate that's a big Second Amendment, champion, because people are not going to question them as much. But you're right. A lot of times it's not always the person who's most passionate. And sometimes that's a mistake that I see made, because they're really passionate about it, but they're just not going to pull the weight in the body that is needed to pass the bill.
Important words. And I want to now kind of segue and go back to that kind of question about opposition. So there may be policies that are very worthwhile, but there may be naysayers. There may be opponents that are fairly vocal. How do you talk about policies that have opposition in a way that invites agreement? I feel like you have this exceptional ability to talk about policies in a way that sort of transcends parties and perspectives and unites people around shared values.
Yeah. So a few quick examples I can think of. Generally, I try to do it in as kind of way possible and look for mutual interests. And so I ran a bill a few sessions ago, I nicknamed Scott's bill, after an emergency room physician who died by suicide. And the bill allowed healthcare workers and behavioral healthcare workers that if they need behavioral health treatment, if their only option is in their own facility, that the insurance company has to grant them a single case agreement to go to another facility. Because in this case, the doctor was, when he had some challenges during COVID, checked into his own psych unit and took his life shortly after being discharged. And so this was an insurance mandate. Insurance companies don't like mandates. So I met with the insurance groups and I explained why this is so important and they should be thinking about the best coverage for their members. And if you like it, knowing the stigma involved a lot of times with mental health, I'm like, if you don't want them to get care, you should oppose this. I know that's not your objective, but I don't want you just to not oppose it. I want you to support it. And they came around and said, we're going to support your bill. And as we were sitting in the witness stand, I told the lobbyist from the insurance group, I said, can I say this is the first insurance mandate you've all ever supported? And he says, if you do, I'm going to withdraw our support. I said, okay, I won't mention that. I'll just let you speak for yourself. Sometimes, though, you have to get a little bit more aggressive. I had a bill on mental health screening that had a fair amount of opposition, and I had an elected official that was up opposing it, and it was going to be a close vote count. And in that case, you have to appeal to hearts and minds. And sometimes you really have to go towards, both of them strongly. In this case, I asked this person, I said, are you going to fight to get rid of vision and hearing screenings in schools? And this person said, no, why would I do that? I said, because those are issues that go wrong above children's necks, but they're not the number one cause of death in Utah. Actually, no kids die from those, but they do die from suicide. And that was a kind of a turning point that I think changed that trajectory. Sometimes you have to kind of, go for the heart of the issue. And there's been other times I've said, do you really want to stand up and oppose this bill, knowing how it's going to help people? And so every situation is a little bit different, but I always think about, you have to have the policy, that's the mind, but then you have to have a good story. And a lot of times somebody who's willing to put their name and face and story to your issue. And that's what oftentimes gets people over the hump if maybe they're just struggling a little bit with the policy.
So important. Thank you for sharing those. And Brittany, I am also in awe of how you've been able to talk about policies, including insurance coverage, in a way that's garnered strong bipartisan support. I'd love for you to share how you've done this on recent insurance bills, and if you can elaborate on how you help people see the value in these policies, even if it's a policy they wouldn't have naturally gravitated toward.
Sure. And I think there too is a little bit of a difference between a reactive bill, so a bill that's reacting to a situation to basically be a response to what happened, and a proactive bill. It's a little bit more difficult to get somebody excited about solving a problem that will happen, but hasn't actually happened yet. And so the one pager that I'm putting in the chat is the one pager for a bill that became law this week or last week, that required managed care entities to do the same sort of parity reporting that commercial carriers do. And with this sort of action, there's a lot of different stakeholders. So obviously people who are insured by Medicaid plans want to have parity, so they're going to be in support. But the sort of uncommon bedfellow in this case were commercial insurers. They already had to follow these regulations. And so by appealing to sort of the fairness of, well, if I, a commercial carrier, have to do this, and you are a commercial carrier doing Medicaid, then that you should also have to do this. So speaking of going neutral, they stayed out of a case of parity where they naturally would have gotten involved. And I think the other part of that too is explaining concepts that are hard to grasp in ways that, again, relate to what people are thinking. And so the way that we explained this was sort of like, when you go buy a new car, which I was a school teacher, so obviously I've never purchased a new car, but when you go get a new to you car, it comes with OnStar for 3 months, right? And OnStar is the promise that you're always going to have that backup. But then you start getting those messages about how, like, it was really just a trial. You didn't get any promise of OnStar. And thinking about that in the context of insurance, when you signed up for your plan, you had all of these promises of behavioral health coverage, promises of a robust network, and piece by piece, those started getting taken away. It felt a little bit more like a trial of a service you didn't actually get to access. And so by comparing it to something that everybody's had a frustrating experience with, we were able to build that connection to say, hey, this is a promise that was made to me, and that promise was broken. How can we put into place ways to monitor and make sure that that promise is never broken again? And so although parity and non-quantitative treatment limitations are really complicated to understand if you're going line by line, fairness is always going to be a concept that I think not only appeals to people, but makes sense.
Oh, that's so important. And that idea of fairness and having an analogy that people can understand, I think, is really critical there. So thank you for that. And Brittany, you spoke about this earlier. After legislation has passed, there's really this need to get it implemented. And during that implementation, unexpected barriers or bumps in the roads can emerge that may prompt additional legislation. Can you share if that's ever happened in Oklahoma? And Representative, I'm sure that's happened in Utah as well, where you've passed something good and realized that, oh, there's some other tweaks we need to make in order to improve upon this policy.
So luckily we've never had to go back with legislation, but we're only 5 years old. So we've run 18 bills at this point, passed 17 of them. But the one, I think, thing that we do in every bill that's really smart is mention rulemaking and the importance of rulemaking to make sure that agencies, if it applies to an agencies, comply with the bill. So even if there's not necessary legislation, there has been times where either the initial rulemaking wasn't done in a way that was consistent with either the intent of the bill or couldn't meaningfully help to implement it, where we've gone back and requested a rule change or helped them change the rules, or more often than not, we're already having a conversation with the agency who needs to implement the bill about what those rules should look like. So when I'm preparing the language, I'm also drafting the administrative rules that would set up the agency to make sure that it can be followed. So I think thinking ahead in how you're writing the legislation as a lawyer, that also means what happens if this is contested, but making it easy for folks to implement. We're not going to run a bill that we don't have a hand in implementation in, because we want to make sure that we don't just introduce an idea and walk away. So we haven't had to do new legislation to address something, but we really believe in the power of rulemaking, and that strong regulation can accomplish most of what you need to accomplish.
That's so helpful to hear. And the fact that you're thinking about rulemaking as you're writing legislation is just amazing and marvelous. And the idea that one can revisit rulemaking, one can go to agencies and say, this isn't working out as planned. And that doesn't take new legislation, but it does take that advocacy at the state agency level. That's fantastic to hear. Representative.
Yeah. So when I was, first starting the legislature 15 years ago, I thought, once you passed a bill, everything's good. It's implemented fidelity and, it's great. Learning that's not always the case. And so working with the agency to see how it's going to be implemented, letting make sure they understand your vision. So it's implemented, with that fidelity is important, but then monitoring it. And a lot of times I'll put monitoring, metrics in the bill, or require the agency to come back to an interim committee and do a report or series of reports, either in person or written. A number of years ago, I passed this mental health screening bill, and I started out way more ambitious than what I could actually get passed. So I had to scale it back, but it was voluntary for school districts to do written parental consent. After it was going for a few years, about 30% of our school districts had picked it up, which I'm like, well, that's good. But I could see the districts that were doing it were having tremendous success, and about a third of the children were being referred for additional services. So I thought, how could I expand this without a mandate? And so I got clever, and I ran another bill that said, it's still voluntary, but every school board has to vote to either do the program or not do the program. And I went to one of our largest school districts that hadn't done it, and I testified, and I said, let me tell you who I wouldn't want to be. I wouldn't want to be in your shoes, having voted to turn away a free resource for parents and children that's voluntary, and then have a child in my school die by suicide or have a school shooting. And I went into this, I said, you're never going to get a full vote on this, Steve. And they voted unanimously for it. The bill passed, and now about 90% of our districts are doing it. And the others are like, we're really close, Steve. So you have to sometimes just kind of keep pushing the policy and tweaking it to really achieve the vision that you're going for.
I love that. That is such an instrumental example, and so clever how you have addressed these things. So one of the things that I'd like to end with is the fact that Healthy Minds, Brittany, pays so much attention to implementation, after which you've mentioned. And that's a real difference maker. Wondering if you can elaborate a little bit more on how you're doing that, such as that learning collaborative. What's the value of that?
So the collaborative care bill was passed a couple of years ago. And through that work, we started a provider community to work on implementation. But one of the things that we learned probably within the first 3 months of that is one, providers want to lead the direction, and that's fine. And that collaborative care, even though that's originally what they thought that they wanted to do, wasn't actually the set of codes that they wanted. They wanted support to do behavioral health integration more generally. And so what we did was we have every 6-week meetings with not only providers, but with our managed care entities, our insurers, our commercial insurers, and our agencies, both our Medicaid agency and our mental health department, to really figure out how can we raise the bar on integration? How can we increase utilization? And we have a huge tribal population. So how can we, and really a lot of integration in Oklahoma started with the tribes, how can we make sure that regardless of what system somebody is entering, that they're connected to somebody who can either screen them about their mental health, can treat an existing mental health condition, or who knows when there's a crisis happening and where to refer. And through that collaboration, Oklahoma was recently selected by the National Council to do the first Oklahoma-only ECHO on behavioral health integration, which means that experts who may have never set foot in Oklahoma are going to be coaching individual clinics in Oklahoma to implement this programming to fidelity. And it's not just collaborative care, because collaborative care, I mean, most of our systems aren't big enough to support collaborative care, but in whichever way we can implement behavioral health integration, those are what the clinics are being set up to do. And it really started with that one collaborative care bill. Like Rep. Eliason said, I mean, he went to his Medicaid agency, and he is a lawmaker, so the agency said yes. I went to the agency and they said, not going to happen. I said, okay, I'll give you 18 months. And if you still decided to no, I'm going to ask you every month in those 18 months. And if you still say no, then we're going to run the bill. That's when we ran the bill. So it's been this process of really making sure that the folks on the ground are bought in to what you're doing and providing them resources, because the reason that they weren't doing it to start with is they didn't have a place to start. So often the bills that we run give providers and communities a place to start so that we're building up a grassroots network of folks who care about behavioral health.
That is so impressive and so inspiring, Brittany. Thank you so much for that. I'm going to turn to you, Representative. Of all the policies that you've passed in support of mental health, suicide prevention, and I know this is like asking you to name your favorite child, I'm wondering, what's giving you the greatest sense of gratification?
Save the zinger for last, Angela. It's hard to name just one bill because they have so many different aspects. I think that the national policy on creating 988, the resolution, I was the only person to run a resolution calling on Congress to do that, knowing that just in the first year, the National Lifeline had 5 million incremental texts and calls and chats. Yes. It's very gratifying. And then to know that Canada said, oh, this is such a great idea, we're going to do it too. So from the tip of the Aleutians to Key Largo, that is the way to reach out for help. That's very satisfying. But when I see the annual report on our mental health screenings and see that about a third of our kids that are being brought in by their parents for voluntary screening or being referred to services, and seeing that that's thousands of children, that's also very gratifying. But at the end of the day, over the past 5 years, our youth and young adult suicide rate has gone down over 20%. And we can't say it was because of this bill or that bill or this group or that group. It's just not scientifically possible. But to see that trend, that is what really puts fuel in my tanks to keep going.
Thank you. Thank you. And with that, I'd love to turn to our class audience for any questions.
Okay, I have a question. Thank you both for being here. That was spectacular. I wanted to know number one, how do you gather support within your state? Like, how do you make those cooperative connections? Did people just find you? Did you seek out people who are working on similar things? how did you build that cooperative network? And also, have you put any thought into building a cooperative network across states, maybe mentoring representatives or leaders in other states that are trying to do similar things so that maybe we're not duplicating efforts, we can get the most mileage out of the work that you're doing?
I take that.
Go ahead.
It's a great question. I touched on it a little bit earlier, but I kind of have to go to looking for the groups that are going to oppose the bill and either try to minimize their opposition or get them to go neutral. But then I look for stakeholders that will support the bill, whether that's like our hospital association or the Utah Medical Association or AFSP or whatever the group may be. I go looking for support. The thing, though, that for me has usually worked really well is there's almost always a story and somebody willing to put their face and story together to come testify, be interviewed by the media. And then I always try to name a bill after somebody. It's informal, but a good friend of mine that kind of revolutionized a lot of our crisis intervention in Utah, a good friend named Charlie, and we called it Charlie's Bill. And he went on the media talking about how he, during a suicidal crisis, was arrested, put in handcuffs, taken to the hospital, big bills, released hours later, and was willing to share that story. That connects to people. It's nice to see a list of groups that endorse a bill, but when they can hear a story like that and say, "Wow, I had a family member that same experience," that goes a long way. In terms of kind of an interstate group, that'd be a great resource. I'd sign up for it if it was out there. I look to Inseparable, which I'm very impressed with the work that Inseparable does to bring people together through these types of webinars and gatherings to help facilitate this type of information. And I'd say more like high level strategy, because each state's going to be a little bit different. But I think learning the principles of kind of how it works, then lawmakers and advocates can adapt it to their own state.
Thank you so much for that, Representative. Brittany, did you have any thoughts on this?
Just that we end up going to different stakeholders. One of the projects we're starting this year is seeking to figure out why prosecutors, and colloquially, why prosecutors aren't using diversion tools. It's what we hear from advocates all the time. We are not an advocacy group. We're a think tank. And so my plan for this summer is to visit all 27 district attorneys in Oklahoma to have a conversation, not about why are you not diverting people, but what are the barriers to using diversion? Do you feel like there's inadequate access? Do these things cost too much money? What would it take to divert more people? What do you think about diversion? And so often it's us going to them when we're not in session. It doesn't mean that we're not still on the ground asking these questions and developing strategy for the years to come.
Thank you for that, Brittany.
Hi there. Thanks for just a really great bunch of sage and practical advice that I think we can take back to our home corners. Question, I wonder if you have, one of the things we're thinking about is how to engage young people more effectively in the policy process beyond just token advocacy, right? Which we've got lots of ways they can be visible, be present for a shout out, but really thinking about helping them to learn the steps of the policymaking process. So welcome any guidance you have on that.
Yeah, we work a lot with youth serving organizations, and we also have helped bring down some federal grants like the System of Care grant, and as part of that have created a youth advisory board. But when you're creating that sort of group, you need to make sure that there's funding to pay youth for their time, just like you'd pay an adult for their time. You don't want to elicit any feedback that won't be taken in some form or fashion, even if it's just an acknowledgement. But I think what's cool about right now is that youth want to be engaged. It's just a little bit different than I think some of us are used to being engaged. So I think we're seeing the same sorts of desires for engagement and working on ways to more effectively bring the youth voice in, and more than just the voice, but finding opportunities to bring youth to the Capitol, to let them know about that, like, you don't have to be 18 and able to vote to comment on a rule and how it would impact how a rule change would impact you. And so you got to be creative. And I think that's one of those things that's really, really place-based.
I'll just answer real quick. One we have a 45-day calendar day session, and 33 working days. And so as much as I like engaging youth, trying just to get bills passed and everything during that 33 working days, it's really difficult to go out and say, my objective is to, just engage youth. But during the interim, I have brought youth groups up, and we'll hold a mock hearing, and we'll give them a topic like cell phones in schools, or whether we should legalize fireworks, something that they're like, I understand this. And we'll divvy them up and say, okay, you're going to be on the committee. You're going to be witnesses in the public for it and against it. And then I'll get one of them to be the chairperson, and we'll do like a mock debate. And so they get their hands dirty kind of in terms of the policy aspects. And that really, I think, prepares them that when there is an issue important to them, that they can come up and actually testify and understand better how the process works.
Love that. Thank you for that excellent question. And do we have time for another question?
This is like a really big one with 2 minutes left, but I just came back from a convening that was focused on the intersection of AI and youth mental health. And the number of times my mind was blown by stuff that seems really obvious. And there's a lot of opportunity for good, but I'm really anxious and scared, honestly. Just curious if you guys are thinking about that from a policy lens and how we even begin this space, because it feels like we're already behind the 8 ball on this.
So I can take a stab at that one. Healthy Minds runs a mental health caucus in Oklahoma. So we do all of the preparation. We have bipartisan, bicameral representatives. One of our mental health caucus chairs this year was really interested in AI. I am pretty risk averse as an attorney. So yes, in one way, it does feel like we're behind the 8 ball, but in the other way, it also feels like we've got one time to get this right. And so if you're going to regulate, you get one bite at that apple. And so we're thinking about it less in that bucket of AI and youth mental health and more in AI and insurance decision making. Is an insurer the one who's making the initial claim denial? Is the insurer or is AI the one who's making clinical care decisions? So we're not thinking about it in AI youth mental health, except for the idea of AI crisis response. I mean, that is terrifying. So yes, we are thinking about it, but it still feels like we have more to learn before we start to regulate, because it's one of those things that people are going to get really tired of passing regulation really quickly.
Thank you for that, Brittany. And I know we're at time, so I'm going to turn things back.
And that's a wrap for this episode. Thank you for joining us as we work to turn mental health policy into real wins that save lives. Remember, change doesn't happen by accident. It happens when people like you make it happen.
Want to keep the momentum going? Visit inseparable.us to find toolkits, campaign resources, and ways to take action in your community. And if today's conversation resonated with you, share this episode with someone who needs to hear it, because mental health advocacy grows when we work together.
This podcast is just the beginning. If you're ready to go deeper, make sure you catch up on this entire series to get trained on how to fight and win mental health campaigns in your state. Because when we organize, we don't just make noise, we make change.
Thanks again for listening. I'm Karis Myrick.
I'm Kathleen Doughty.
And I'm Eliason, and we'll see you on the next episode.